Alrighty. Good morning, everyone. We're returning from recess after our Board of County Commissioner meeting and reforming as the Elbert County Board of Health. Amanda, could you call the roll, please?
Commissioner Richardson.
Here.
Commissioner Thayer.
Here.
Commissioner Schroeder.
Here.
Alrighty, we have a quorum. So if you could, Dwayne, could you take us through the update?
Good morning, everyone. Good morning, commissioners, staff, folks listening in, and guests. Dwayne Smith, Public Health Director here to provide a quarterly update. I'm going to start with thanks. So everyone's familiar with the challenges with the weather and the resulting impact on the Road and Bridge Department, but I want to point out how important that is for the many healthcare workers that reside in the county, that work in hospitals and other facilities outside the county, that need to get to those primary care, acute care facilities outside the county. So just again, echoing the thanks and appreciation for the long hours for Road and Bridge that they've been putting in and continue to put in so that our healthcare professionals can get to work and take care of folks. Likewise with Office of Emergency Management and Finance and also Human Resources as we've been working to fill some positions. So, okay. So our agenda for today, typical of previous updates, staffing updates, updates on the clinic and what's going on with communicable diseases and environmental health, and vital records and health promotion. Again, just revisiting our foundational public health services. Today I'm going to focus a little bit on the one on the right on access to and linkage to health care. By way of a staffing update, we have backfilled our vacant family nurse practitioner position. Dawn Newbury joined us in early June, and her day job is Centura? Yep, so she's a family nurse practitioner with Centura, and she's with us on Tuesdays. First time filled our finance and grant specialist position. We have Teresa Claus on board, and she has hit the ground running and is doing a great job getting all of our finances understood so that we can, we've already started having meetings and conversations about budget planning for next year. Our public health emergency preparedness coordinator, we've had many candidates apply. We've interviewed, initial interviews, probably 6 or 7. We have another interview tonight. And we've had a couple recent applicants that look good on paper. So, and just as a reminder, the nurse practitioner and the finance and grant specialists are funded through the state health department's workforce grant. And there's the breakdown you can see after that. So how do we compare with local public health agency staff in other counties? Some ways we compare right about where we should be. Other ways we compare not so favorably. So everyone's continuing to wear many hats. I would say we're very close to getting to a staffing model that can effectively serve the county and as it grows. Okay, so by way of updates in our public health clinic, I want to recognize Lisa Helseth, who submitted the application to Colorado Department of Healthcare Policy and Financing and followed up numerous times on that after it was submitted, and they said, we didn't get it. We are approved as a designated essential community provider. That's critical for a county like ours that doesn't have a hospital, only has a couple primary care practices, so that we can serve folks who may be on the margins of having insurance or being underinsured. So essential community providers cannot be excluded from provider networks where health plans serve particular communities. That was initially, you may recall, when we were going through the credentialing process with third-party insurers, some of them would tell us our panel's full, so you would be out of network and so on and so forth. This designation helps with that so that we can be in network and get reimbursed at a better rate for some of the services we provide. The designation lasts for 3 years from the date of authorization. I want to say the authorization was in June, so June of 26, we'll need to reapply.
So, based on your comment about the need to keep following up to make sure this got through, is that something we should start working in about 2 years for redesignation, or?
You know,
I guess it's significant if there was a gap in authorization.
As our services grow, we will concurrently be compiling metrics on a monthly basis, whether that's patients seen, whether that's revenue, whatever that is. So we'll concurrently be building the necessary data sets so that when we do have to apply again, because a certain percentage of, I want to say 25%, as an essential community provider, after 3 years, we need to be able to demonstrate 25% of our clients are at or below 250% of federal poverty level. So that is one of the criteria for redesignation. So obviously we'll need to be tracking the number of patients we serve that are under 100%, 150%, and then up to 250% of the federal poverty level. Before I go to the next slide, we are just in the formative, well, I guess I green-lighted it with the column that will be in the Ranchland News tomorrow. So we are going to be able, or soon going to communicate on a broad level the ability for our nurse practitioner to do home visits. So we had kicked that idea around. We know that particularly with seniors who may have transportation barriers, particularly in inclement weather in the wintertime, the downstream benefits are so great, and it'll be an ebb and flow. You know, obviously, if we're doing home visits, that limits the number of people that we can go see. However, in conversations with, for example, EMS, that may have some frequent callers for their services, if we can mitigate that by doing an in-home visit and providing in-home care and looking at medication review and making referrals to the necessary specialists and so on and so forth, that saves the whole county money, not just Elbert County government, but fire rescue squads. Obviously would cut down on unnecessary visits to the emergency department, urgent cares, things like that. So thanks to Sarah McIntosh, we are now a Vaccines for Children provider. Sarah, do you want to come up and say a little bit about that? To put you on the spot.
Sure. Sorry, I wasn't really prepared to say a whole lot about this, but Vaccines for Children is a service that we used to offer a long time ago. It covers mostly our underinsured, our Medicaid patients, and for kiddos for routine childhood vaccines. So this is a program that allows us to get these vaccinations for free from the state. so that we will not pass on any charge to the patients, and Elbert County will not incur any of the charges for the vaccines. As I've been purchasing vaccines for private pay patients, I'm discovering those are fairly expensive medications. And so the recent order I just placed through VFC was actually for $10,000 worth of vaccine that they just sent us. So we'll be able to pass that on as a service to the public. Anybody who's Native American Indian will qualify for these vaccines, as well as, like I said, anybody who's Medicaid automatically qualifies. And also the other piece I learned is that people that do health insurance co-ops through religious organizations qualify as well to get those vaccines. So hopefully that will be a big service to the community to have that nearby.
Thank you, Sarah. Sports physicals. We're coming up on new academic year. Students participating in extracurricular activities that need a sports physical for CHASA requirements. You won't find them cheaper than $20. Again, if a student or family can't afford the $20, we're still going to give them a sports physical and sign off on that letter so that they can participate. Clinic is growing slowly but surely. 81 clients served this past quarter, April, May, June. And you can see the pediatric and adult breakdown there, 19 immunizations. Our volume of drug, pre-employment drug tests continues to grow. We've reached out to the municipalities. I know the town of Kyle has sent us a couple folks for their needs, and we've reached out to the town of Elizabeth. I just put a voicemail in to Patrick Davidson, so haven't heard back on that. But just want to make sure folks know that's available. We can do that for a nominal cost. Continue to conduct tuberculosis tests, and you can see the breakdown of the COVID tests conducted. Jail, Elbert County Sheriff's Office jail being the most frequent need there. This quarter, or this past quarter, we've started having the third-party payer revenue trickle in. And I know we're off to a pretty good start in July for this current quarter. So important to note that this was somewhat limited because our nurse practitioner role was vacant virtually in the entire quarter. So environmental health, this is pretty self-explanatory. What I do want to highlight is a free seminar for homeowners and real estate agents. And I have a poster here. We're going to be hanging these posters in common areas around the county, community bulletin boards and whatnot. This is going to be a free seminar on Wednesday, August 16th from 3 to 5 p.m. in the Ag Building, where we have a certified trainer from the National Association of Wastewater Technicians. Will be providing information on septic systems, how they work, how they function, how you can properly care for and maintain them, and most importantly, what the permitting process is. Well, why is this important? Probably our most frequent interaction with the public is related to septic systems. I want to remind folks that may be listening, you do need to have a permit to do virtually anything related to septic. We are in the midst of an incident where a homeowner had a full septic tank and was evacuating the tank into their yard. So that is not allowed under state or local law. And obviously that's a public health issue and a nuisance to the neighbors. So just call us is the takeaway, and we'll walk you through everything.
If I may, I'll send you, there's DMAR, the Denver Metro Realtors Association, has a government liaison. I'll shoot you his contact info.
Okay, great,
He
thank you.
probably has mailing address or email contact with all the Elbert Realtors. So.
And I think Marissa sent this to all the realtors in the county and probably adjacent, but we can always send it out to more folks. Septic inspections are down. This is weather related. Obviously, we can't inspect when the property is flooded. So we're a little bit behind for the year on that. And accordingly, our revenue's a little bit off pace, hoping for good weather so that we can make that up in the remaining 6 months. And there's our flyer for the seminar. Yeah. Oh, yes, thank you. So on the seminar for folks that cannot make it, we are hiring a videographer to record the session. Staff have already met with them to make sure the sound quality is going to be good and the video quality should be very good. And we will not only post that on the county website on the septic page, but also on YouTube so that folks can see that prospectively. So this is probably something we'll only do every other year. So hopefully this will be the first of an every other year learning opportunity. Biosolids applications, no issues there, although noting that we've had a lot of applications. Typically we might only have 8 or so a quarter, and there was, we did receive an application from a property owner that is opting in, and they are, I forget the exact township, but they were almost at the top of the L, and that's that part of the county. It's actually a Lyman address, but it's an Elbert County property. And it is dry land farm, and the fields are fallow, so no concerns there. Vital Records continues to grow. Of note, we have connected with, as folks come into the post office in Kiowa for passport services and don't have a birth certificate, the postmaster is sending them over to us, so that's contributed a little bit to that uptick. And our revenue is slightly ahead. Not a huge revenue generator, but certainly covers, more than covers our staff time to issue those. Health promotion updates. So the WIC program, this is a challenge. So recall that in partnership, collaboration with Douglas County Health Department, they send a couple WIC educators to Kiowa on the 3rd Tuesday of the month. With the exception of a couple folks from the Nurse Family Partnership Program that Shelley Blazer has brought in. We've had 0 folks call, 0 folks walk in. Obviously that's concerning because we want to be good stewards of their time that they are donating to Elbert County. So anyone listening, if you think, or if you know someone that you even think they may be eligible for WIC services, please have them contact us and we'll get them squared away. In the absence of a demand for this service, we really can't justify asking Douglas County Health Department to continue this for the long term.
Yeah. Have we by any chance reached out to the food banks in the area to promote this?
Have we? I think we have.
Last summer, last fall I did, but I haven't really been out there this year yet.
Okay, so it sounds like we need to.
Yeah, and there may have been changes in folks working at the food banks as well in that time. It seems like at least that might be a population that could be served by both.
We continue to publish the weekly updates via Constant Contact. Again, anyone can receive that. They just need to let us know to have their email address added to that distribution list. And we continue to write the weekly public health pulse columns for the Ranchland newspaper. There's our contact information. We have near daily updates on Facebook on a variety of topics and resources. We have a wealth of information on the county webpage. Folks can reach out to me via phone or email. And I guess in summation, things I didn't cover, we've had, I guess I should mention mosquitoes. I've had a couple calls for mosquitoes, not an overwhelming amount. We do not have a mosquito mitigation program. We don't have a mosquito truck. And I've gotten a couple calls, and I think Environmental Health has, about concerns about rabid birds, small rodents, things like that. If it's a bird, my concern is West Nile virus. We actually turned that most recent one, about 3 miles, there was an inquiry of some dead birds and birds that wouldn't fly about 3 miles south of Kiowa, and we turned that over to Colorado Parks and Wildlife. And so hopefully they're getting a specimen that they can test for West Nile. To date, we are unaware of any West Nile infections in the county. So, but there have been confirmed infections in Arapahoe County, so it's most likely in the county. We just don't know about it, or don't know that anybody's been infected. So, and at this time, I'll entertain any questions.
I've got one curiosity question. Back when I was first elected for a commissioner, that biosolids that was going up in the northeast part of it, there was agreements under which we would get reimbursed for inspections and things like that. And it was something that had never been followed up on in years. What's the status of that now?
So the status is the contract expired, I believe, at the end of 22, so December 31st of 22. Have not seen any new contract. The obstacle for the reimbursement was we didn't have a staff member who was trained in conducting the inspections for those biosolids applications and to monitor that program. So therefore, we weren't able to avail ourselves of any funding from that contract.
So is there a new contract that you're negotiating now, or?
I have not heard. I'll reach out to Metro Wastewater, Denver. It's changed names. But no, nothing to report on that.
Just a couple questions back to the beginning on your staffing update. That were being funded by CDPHE Workforce Grant and then the Emergency Preparedness Grant. Is there an end to that, or is that an ongoing grant, or at some point will we have to pick up those employment costs 100%?
Yes, there is an end to that. One grant, I believe, goes through 26. We're set for the next, well, let me break those down. So the family nurse practitioner funding, that funding for their salaries is through June 30th of 24, so 11 more months. As we generate revenue from the clinic services, the thinking is that those positions will be self-sustaining through the revenue we generate. So we'll most likely segue off that beginning July 1st of 24. The finance and grant specialist and the public health emergency preparedness coordinator, I believe those are the ones that go through 26. The city's readiness initiative, which provides 25% of that emergency preparedness coordinator, that is something that is that funding, Elbert County is included in the Metro Denver area. So there's 7 or 8 counties in the metro area plus Elbert County that are funded for that city's readiness initiative. Because we've never had that position before, we haven't had the opportunity to avail ourselves of that funding. The other 75% from CDPHE, like I said, believe goes through 26 for that, probably June 30th, because that's the end of the state fiscal year of 26. And we probably would not hear, I would think, probably for another, I would guess at least 2 years on continuation. So it's, you know, these are largely federal, well, the CDPHE grant is typically federal pass-through funds from the CDC, Centers for Disease Control and Prevention. So long-term planning, we cannot rely on that, but more practically, I think we will continue to see opportunities in one form or another. And obviously, we're continuing to, you know, monitor and reassess year over year. I'm hoping, and I hate to put timelines on things because I thought I would have had a qualified candidate by now. I'm hoping that emergency preparedness coordinator, we have someone on board in September. And you're probably aware that emergency management just had one of their folks start, Shane's new emergency management coordinator. So our role in public health is going to be working very closely with that role in emergency management.
Okay, thank you. And then the other question I had, we had talked, I don't know if it was at a meeting or just off, that the nurse practitioner would be able to do blood draws for elderly that couldn't get into the different LabCorp or wherever. And then I assume that's where a lot of this, or a part of anyway, of what we're servicing at this point through that.
I'm sorry, could you repeat that? You said, I assume?
Yeah, well, I assume that some of our clients served here are the blood draws, and just wondering how that's working out, what agencies were able to get orders from, if that's just on
I'll let
Tuesdays.
Sarah address that. She set all that up.
No worries. So it's kind of twofold. So Quest has us listed as a draw site. So if you have a primary care provider that's in Parker, that's in Douglas County, that's in Castle Rock, they can put in an order through Quest and we can draw it. So for example, you don't have to come see our doctors, you just make an appointment with the nurse, with me, and I can come draw it on site. If it's someone that's homebound, I can make a home visit and come do that as well if need be. But that's outside of any of our provider scope. I mean, they could, but it's not worth the squeeze for them. But they can also take on patients and see them in office too. So if there's someone who doesn't have a primary care doctor, who wants to be seen and have a basic well visit, who maybe is out working on the farm and cuts their hand and needs a couple stitches, we can come help with those sorts of things. And those patients we can draw labs for as well, but they don't have to be associated with our clinic for us to be able to draw the lab work. As far as the numbers we showed, not a whole lot of people have taken us up on it so far, just a handful. So what from the numbers you're seeing, there's not a ton, but hopefully that'll grow as people learn and more people know that we're here to do that.
So they would just need to take their order from their doctor and bring it to you, and
you got
it would be taken care of.
And as long, there's a workaround I have that if their physicians can order, because there's 2 blood draw companies that are willing to do lab work. One is Quest and one is LabCorp. So if your physician happens to order through LabCorp, if you bring me a printed copy of it, I can run it through Quest and then just have the results faxed to your doctor that way too. So just makes it more convenient if you have fasting lab work. That way you're not waking up first thing in the morning, not eating anything or drinking anything, and driving an hour into town to have blood drawn. By the time you get there, you're hangry and it's not so much fun. So having something a little closer to home is a little more convenient for those.
While you're up there, sir, if you could, I guess, just have a chat with Sean Vanus at the ECOG.
Okay.
Just kind of remind him of what we have, because they do a lot of communication through the AAA to our aging population.
Exactly. Like I said, these numbers are pretty low. Our clinic is pretty open. Most days we can fit people in same day. Obviously, Mondays and Tuesdays are the days that the providers are there. I can help with some basic stuff on Wednesdays and Thursdays, and blood draws can be Wednesdays and Thursdays. It just is a little bit more dependent on the day of the week and who's there. So that's kind of our big limitations right now. But I'm hoping as people hear we're out there, that those numbers will continue to grow.
Great, and then my last question.
Yes. Me or Dwayne?
You had mentioned drug tests conducted for employment in the presentation. Is the county utilizing that? So we're not having to send out anymore? Because I know that was a discussion, so that's,
Yep, so
that's a savings
we're
and that's
open to do
terrific.
it for all county members. I can even do, if it's a spot check, like if there's a road and bridge incident, I can even do those spot checks on the spot. I only will release them if the results come back negative. They're released from our county, so for liability, if something comes back positive, then it gets sent out for additional testing just to verify the positive so that we're covered as far as legal stuff there.
Okay, terrific, thank you.
Yep.
Dwayne, back on personnel, I know we were at one point looking at an epidemiologist shared regionally. Have we abandoned that, or?
For the most part, yes. Probably what we'll transition to, if I can't contract with the state for those data crunching needs on, we might have a month's worth of work. And if we can work out something with the state, might need to just rent or do a quick contract. I call it rent an epi. Because when we need it, we need it. But we probably don't have enough work for a full FTE year-round. So, yeah, continuing to monitor that. At some point, we're going to have to execute a time-limited contract. And then along those lines, I will mention, because this came up yesterday, so we had to issue a notice of violation for an environmental health violation to a resident where English was not their primary language. And I should thank Sergeant Estrada at the Sheriff's Office for translating the notice of violation into another language for us nearly at a moment's notice, and he got it back to us within 24 hours. Very helpful, but and we're also exploring with the language line. We've put an inquiry into the language line, so they would provide translation services, for example, in a clinic service or whatnot, but so we inquired about document translation. And they said, yes, we can do it on a contract basis, but we may need rent a translator for document translation purposes. And that's not just our department, it could be any other department. So just putting that on the radar, so.
That's all I had. I asked, kind of went throughout. Anything else? No, yeah, definitely appreciate what your small but mighty team is doing. So, thank you. So with that, I think we don't have any other business as the Board of Health, so we can close as Board of Health, and I'll take a motion to adjourn for the day.
Mr. Chairman, I move we adjourn for the day.
Second.
A motion and a second to adjourn. All in favor, please say aye.
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 Aye. Motion carries. We're adjourned.
Thank you.
Thank you.